Hello, I'm David Lozada. Welcome to Rappler Talk. According to the World Health Organization, the Philippines has the fastest growing human immunodeficiency virus or HIV epidemic in the world. As of July 2015, the Department of Health reported that around 22 Filipinos get HIV every day. What's more alarming is that the country is lagging behind the global trend. The United Nations reported that HIV infections have declined by 40% between 2000 and 2013 globally. Today, we'll talk about what the public can do to help prevent the spread of HIV in the Philippines. Joining us is Ronivin Pagtakhan, founder and executive director of Love Yourself, a community of volunteers that aim to prevent the spread of HIV/AIDS among the youth and key affected population through awareness, counseling, and education. And Evan Tan, the administrative head of the Red Whistle, a collaborative platform for people to come together and show their support against HIV and AIDS. So good afternoon.
Good afternoon.
For you, what is the root cause of this problem, the HIV epidemic in the Philippines? How did HIV specifically in our country become an epidemic?
Evan, do you want to go first?
Okay, I think it's more of the complacency regarding the issue na people thought na the Philippines basically like we're not, like the youth are not having sex, you know, like parang the Catholic Church being a conservative country, na it's not something na priority natin, and basically, yeah, that's what happened. So,
well, I think it's twofold, no? So number one is, if you look back in history, HIV started here in the Philippines around 1984. And the focus of the Department of Health is more on the sex workers, OFWs, but they didn't seem to look at different segments of the population wherein HIV is, I mean, the rate is growing. For example, the male sex workers and the MSMs particularly. And then in 2006, suddenly there was an upshot in the number of cases. Maybe that's number one, the prioritization and not being able to see the people who are actually hidden and they have a chance of acquiring the infection. And number two is awareness. Well, awareness can be dissected, no? Awareness with change in behavior and awareness knowing but not really doing something about it. I think those are the main reasons why there was a sudden upshot of the cases.
Yeah. So given that, or aside from the DOH or the government overlooking the segments of the population, like what is the government right now doing enough? Specifically the Department of Health and DepEd. Why or why not?
Evan, I'll go first.
yeah, sure.
I believe each of us should have our own role. I mean, in defense, I mean, no offense meant to the government, but they're already doing their job. I mean, they're doing their jobs. They have different programs. We have social hygiene clinics. We have programs for the sex workers or what we call entertainment-based workers, wherein they cannot do their activities or their work if they don't submit themselves to screenings, STIs, and HIV alike. But at the end of the day, it should, you know, our interventions should have diversity. As they say, different strokes for different folks. Maybe the government is doing their job, but there other people, the community, the LGBT community, human rights activists, RH people should have the same activities as what the government is doing already. I think that's one way to curb the infection or the epidemic. If you're gonna ask if are they doing their job, I mean, they're doing their job. Kaya lang, diba, we have limits. Yeah.
So yeah, it's same thing. I think it's more of becoming more inclusive. Na the messages are being targeted specifically to MSM where the numbers are rising, and also na there are more messages being catered to the youth. Na right now, yun nga yung like basically yung roadblock na like young minors cannot avail of the tests. So that could be something that the government can look at, since usually it's around 16 that young people engage in their first sexual activity.
And it's getting younger and younger.
Yes, it's getting younger and younger.
Given that, the most at-risk segment of the population is the men having sex with men.
Yes.
But we know that women and even babies can get infected with HIV. In fact, according to the World Health Organization, mother-to-child transmissions in the Philippines increased during the past years. So what needs to change in our understanding of HIV?
yeah, basically number one, sex should not be taboo. Diba? Here in the Philippines, parang when you talk about sex, parang
like,
it's
no,
bad,
let's
it's
not talk
wrong.
about
Yeah.
it.
Diba? I think that's number one. No? An intervention that focus on making, sex is a physiologic need. So parang making sex not that special, not that taboo, being gay not taboo. I think that's one of the things that should start na mag-change sa atin para magkaroon talaga, the mindset of the people. Parang basically it's behavior change, pero we need to let the people know na HIV is not just for the LGBT MSM community, diba? It's everyone. Diba? Sabi nga nila, it's not who you are that puts you at risk. It's what you do. And as long as you're engaging in those risky sexual behavior, you're at risk.
I agree. Definitely, yun nga, like, previously, like, parang the media would say na parang call center agents, like, that's where the rising numbers are, like MSM, like, the LGBT community are basically at risk. Pero what we need to focus on is that, yun nga, what Vin said, it's not about what you, like, who you are, but what you do that puts you at risk. Na what exactly are you doing? Like, if you're having unprotected sex, you're basically at risk. Na we shouldn't give people that false sense of security na just because they're not MSM, they're not sex workers, that they're not at risk. If you engage in sex, you're basically at risk.
But how would you do that? Like, making sex not taboo in a country that, or in the face of the Catholic Church's conservative teachings?
Well, that's a very tough question, no? Kasi knowing the culture in the Philippines, diba, you need to, siguro, different approaches yung gagawin natin. Number one should be advocacy, policy advocacy, and also talking to key stakeholders na could actually be, one of the people who can advocate for the things that you want to. Kasi dito sa Pilipinas, before you'll be able to do something, kailangan may support ka nito, may support ka niyan. Pero us, for example, diba, we're from community-based organization. One way or another, we're trying to do things naman para mais itong problem na to na sex being taboo, being gay as taboo. For example, sa amin sa Love Yourself, we believe in sex positivism, 'di ba? Yun nga some people say na yung hashtag negative is not how do you say that? Inclusive. Pero the program is all about staying negative. It's not about, no offense meant to the PLHIVs, pero we have programs for them. And, diba, we reach out for them. Pero, how do I say this? A campaign like that, syempre, maganda rin na we support things at saka yung mga efforts that promotes, diba, being seronegative. Kasi, diba, prevention is still better than cure. For PLHIVs naman, syempre, we have programs for them. And also, we help them become self-sustaining. We help them become, the way they are before the infection. Kasi there's life after the infection, sabi nga nila.
So, I agree. At the same time, I think na when we talk to the youth, when we talk to young people, na we shouldn't make it a special thing, sex. Like, when we talk about it, like, nahihiya, na, like, parang, you squirm. But talk about sex in a very clinical manner, in a very matter-of-fact manner na it's something na the young people should understand that way na it's not, hindi dapat tayo nahihiya when we talk about it. So, like when we talk to young people na we don't make it stupid, na we don't dumb it down for them, but talk in a way na educational, na ma-enlighten sila about like how you actually contract HIV, na what can you do to prevent getting HIV.
You mentioned earlier yung mga communities nyo as organizations. Can you briefly talk about what your organizations are doing to raise awareness on HIV?
Oh yeah, so basically in Love Yourself, we have 2 clinics. One is in Malate, corner San Marcelino, and the other one is just nearby. It's along Shaw Boulevard. It's called Love Yourself Anglo. We basically provide free HIV screening, hepatitis, and syphilis screening for clients. So basically, it's our interventions are focused on MSM, but not limited to MSM. So basically, we have like, say, 50 to 70 clients per day for each clinic, roughly around 700 per month, and I'm happy to share that we were able to provide almost 45% of all the newly diagnosed PLHIVs last year just in Metro Manila. So I think it's a good way to reach the population that we want to reach, who are the young MSM, young working MSM. And now we're also having we also have a program called Love Yourself Caravan. Love Yourself Caravan is a program that's focused on bringing HIV awareness and testing closer to the universities. Aside from that, we have a new program called PBSR, Philippine Business Sector Response to HIV, in partnership with the Filipina Shell Foundation, wherein we go around companies and we provide HIV 101, and we help them craft an HIV in the workplace policy. Aside from that, we do small activities that's more on awareness, like awareness campaigns, photo shoot, fun campaigns, because our approach is more like we separate the hardcore HIV activities from the, just branding and program activities, because we want people to look at Love Yourself as if it's not an HIV awareness group. Because it's really not just that. It's about, one, developing self-worth in order for a person to reach his maximum potential. I mean, in order for him to become who he really wants to be. So basically, those are the things that we do. Aside from that, we also have learning and development. We help other volunteers. Right now we have 728 volunteers. We help other volunteers go into training, like peer education, counseling and education, things like that. And then we also have what else? Events. And then we also have partnership with other organization called the IC and HIVOS program, wherein we help other community-based organizations become self-sustaining and become, develop, grow in such a way that they'll be able to help their community in their own locality. So there.
How about for the Red Whistle?
For us, for the longest time, we've been doing a campaign called with Headshot Clinic, na yun nga, photo shoot din since 2011, raising awareness about HIV and AIDS. And at the same time, we also sponsor events, and we also do partner with brands, with companies. Just nung Labor Day, we did something in Boracay with the Love Yourself. Yun nga, na we went around Boracay, Save Sexy. We educated people, like generated awareness basically, and talked about HIV and AIDS among the young people who are going there. Next year, we're doing something in collaboration with the QC local government, and it's still in the works, but we're bringing it closer to the youth. Now, if Love Yourself is doing it in universities, we're bringing it closer to 15 to 17, like high school students. But I'm not of the liberty to disclose pa.
Love Yourself works closely then with people living with HIV. It's been said before na contracting HIV now is no longer a death sentence. So how can people living with HIV, for those who, for example, who get tested and they are reactive to the virus, how can they live fruitful and normal lives?
Well, basically, the first step there is getting yourself tested. I mean, awareness first, and then getting yourself tested. Once you know your status, if it's negative, we want people to maintain their seronegative status. We ask them to go back to the clinic every 3 months, with or without risk. Free naman eh, so there's nothing to lose, diba? And second one, if the person or the client is reactive, we immediately refer them for treatment. So we have our partner hospital and the Research Institute for Tropical Medicine, which is the research arm of the Department of Health, for which all of the clients tested reactive there in our clinic are referred there, and then they just spend 125 pesos for the hospital card, and the rest is free. And then, syempre, pag nalaman mo na yung status mo, you'll be able to take care of yourself better. Bakit? Kasi once you go for the baseline in the Research Institute for Tropical Medicine, or we offer naman yung other treatment hubs natin like PGH and Lazaro, Makati Med and Medical City, and yung mga newly formed na satellite treatment hubs, we offer them. Pero syempre, dahil partner namin yung RITM, we prioritize yung RITM. So once they're there, syempre makukuha na yung baseline nila. You'll be able to determine kung ano yung needs ng body. If the client needs to take ARVs, the doctor will recommend giving the person living with HIV with ARVs already. Pag hindi naman, the doctor still gives the option which is good. And then, eventually, slowly but surely, makikita natin yung improvement ng CD4, and then the viral load goes down, and then eventually, I think in a year or less, diba, the viral load could go undetectable. And it's as if you don't have it. I mean, you have it, but
it's dormant.
It's dormant, yeah. And diba nga, you can live a normal life naman as long as you're having a healthy lifestyle, you're taking your meds regularly, yung adherence mo is good, and also, very thankful kami sa Love Yourself kasi diba we're focused on prevention, but there are many organizations such as the Red Ribbon, Pinoy Plus, what else? Yung PAFP, in Cebu, we have yung Cebu Plus, who help naman PLHIVs. Kasi, di ba, parang sa Alcoholics Anonymous, di ba, it takes one to know one. I mean, it's nice that you have people who experienced the same way help you. Kasi, di ba, nakikita mo na sila, they're living a normal life, okay sila. At may inspire naman yung mga PLHIVs na, uy, nangyari sa kanila to, pero look at them now.
Do you have anything?
Basically said everything, but just to add to that, na yun nga, na a lot of people think na HIV is a death sentence, which is not true. Like once you take the meds, you can basically suppress the virus in you. At the same time, taking the meds also prevents you from transmitting it to other people. So we need to highlight that. We need to encourage people who are positive to actually take the medications and to constantly get their checkups, visit their doctor. At the same time, it's not a license din naman na, oh, I can take the meds naman pala and like not transmit it, because you know it's a lifetime thing. Like we still don't have the cure, but you can suppress it in your body. At the same time, if you're negative, like might as well not get it na rin, because you know like it's a commitment. Once you take the meds, you have to take the meds forever. Well, for a lifetime.
We have a question from social media at Nile_Villa. Would the legalization of same-sex marriage help curb the HIV/AIDS epidemic?
That's a tough question. I think it will affect, but it's not really the legalization of same-sex marriage, not creating a culture of equality, but more of encouraging na it's something na normal, it's something na like you know like a lot of these young gay men are driven underground, not disclosing, staying in the closet, not getting tested because they're afraid nga na society is basically discriminating them. Like parang same-sex marriage is just a result of creating that culture of being welcoming, being more accepting, but at first like we have to understand na parang the LGBT community is here, we're here to stay, and we have to be more accepting. Like the majority has to acknowledge na they're not doing something wrong, they're not evil, but they are who they are. So maybe start first with acceptance. I don't even want to use the term acceptance because it's kind of like but yeah, na create a culture na loving, welcoming, and understanding.
As a final question, like even when getting tested, it's seen as a stigma. Like it's a sign that you have a lascivious lifestyle. How do we change the stigma? What can the public do to help stop the spread of HIV in the Philippines?
Well, kami yung approach namin last year we had this campaign called Project Indulge. It's like making people realize that HIV screening is just like having a haircut, going to a salon. Na it should be part of your normal wellness routine, just like in women, diba? They have their pap smear, diba? If you're into penetrative sexual behavior, or you're engaging in unprotected sex, diba? Naturally, you should have. I mean, that's part of your wellness routine. Dapat na you should have, and you should get tested regularly. So parang ganun, and normalizing HIV and HIV screening. Aside from that, I think one important thing na kailangan i-offer natin to the public is the possibilities of other interventions. Kasi di ba right now, it's always A, B, C, D, E. Di ba? Abstinence, be mutually faithful, correct consistent use of condoms and lubricants, do not share injecting drug needles, and then E for education. I mean, those are already given. Pero bakit nagkakaroon pa rin ng rise ng mga cases? Baka kailangan natin ng mga ibang option. I mean, in other countries, there are PrEP, di ba?
Yeah.
Yung mga pre-exposure prophylaxis, post-exposure prophylaxis. I think it's nice that we can look into those kinds of intervention. Aside from the present interventions na working naman. Kasi there are interventions working, there are activities working naman. Pero it's a reality kasi di ba? The rise in the number of cases of HIV here in the Philippines is a double-edged sword. Number one is, the cases are rising because marami na talagang may HIV. Pero nag-rise rin yung case kasi, di ba, more people are actually getting tested kasi they're more aware, more conscious of their health. I think continuing those good practices plus adding a few more. Ang problema kasi natin dito sa Pilipinas, pag nakakarinig tayo ng new practice, we tend to, you know, parang
it becomes a license.
Yes,
So, they're encouraging people to have sex. Like, parang
like, di ba, yung needle reduction program, parang
you're encouraging people to use drugs.
Yeah, well, in fact, it's a risk reduction program. Di ba? Parang, I think we should never say that something isn't effective unless we try it. Di ba? Parang, yun yung bottom line eh. Parang opening more doors for more intervention, more ways to help the community para ma-hasten natin yung pag-increase nung or pagdami ng mga taong may HIV.
And the effectivity of these practices has been proven na like in other countries na yun nga PrEP, like parang they determined na basically it prevents more infecting other people na if you're positive nga na if you're negative and you're taking like yung pre-exposure prophylaxis, basically you can't get the virus. Same time treatment as prevention, like that's already happening. So to support what Vin said, it's really adopting other things that aren't currently being done here in the Philippines. If it works, then why not, right? If it doesn't, like that's something that we can tweak and make it more palatable or more better basically for the setup here in the Philippines.
And also not forgetting, syempre, yung mga PLHIVs natin.
Yeah.
Di ba? I mean, they should also be part of this, you know, curbing
They should be on board.
the epidemic. So, I mean, on board in terms of not just dun sa treatment, care, and support, but also supporting the prevention. Kasi, di ba, if there's a person that would know the experience of having HIV, sila yon. So, I think meron silang magandang input pagdating sa prevention.
So stopping the stigma really is basically yun nga educating yourself and loving yourself.
And stop
like,
stop yung self-stigma. Kasi that's one of the things na kailangan rin at importante. Kasi minsan meron tayong self-stigma. Parang being gay, di ba? Parang and just like PLHIVs, pag PLHIV ka parang minsan may self-stigma. Pag gay ka may self-stigma. I think stigma is double-sided rin eh. Stigma from others and stigma from yourself.
Okay. As a final thought, how do people get in touch with you if they want to be involved in Love Yourself or The Red Whistle?
So go to www.theredwhistle.com. You can contact us there and also look for us on Facebook. That's facebook.com/theredwhistle. You can message us and you can email us at theredwhistle@gmail.com.
Sa amin naman, our Twitter is at loveyourself.ph and our Instagram is the same. And our website is www.loveyourself.ph. Ang Facebook rin namin is facebook.com/loveyourself.ph. So, and they can also visit our clinic. So, it's open, ang Malate clinic namin is open Thursdays to Mondays. And then our clinic naman sa Anglo in Shaw is open Wednesdays to Sundays, 12 noon to 8 p.m.
Okay. Thank you. Thank you. Rappler's civic engagement arm, MovePH, actually has started an HIV/AIDS campaign, #StayNegative. That's with an HIV in the middle of negative. This is spearheaded by our Move communities across the Philippines, given that we saw that it was a big concern for different areas, and held in partnership with DM9 and Love Yourself. So join the conversation and share our stories using #StayNegative. I'm David Lozada. Thanks for tuning in.